and good evening. I'm Melissa Idris. You're watching Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. You can now register to be an organ donor through the MySejahtera app. Now, it is hoped that this will make it easier for more people to register as organ donors, as according to the Health Ministry, last year, Malaysia had among the lowest transplant rates in the world. However, there seems to be a lack of education among the public about organ donation, which would go a long way to dispel some of the commonly held misconceptions about being a donor. So joining us on the show today to help shed more clarity on the issue, we have Dr. Hasdi Harun. He is the head of the Quality and Risk Management Unit at the National Transplant Resource Centre. Dr. Hasdi, thank you for joining me on the show today. Maybe you can begin our conversation by helping us understand a little bit better how many people in Malaysia have signed up to be donors and how many people are actually on the transplant wait list. I guess I'm wondering, with how many people who sign up and how many people are on the wait list, how many organ transplants actually take place each year?
Right, thank you. Okay, what happened is now our organ donor pledger that we have in our database is about 500,000 Malaysian has registered as a become a donor pledger, and whereas our transplant waiting list is about 10,442, and majority is actually a kidney patient in the waiting list for transplant. And then the number of transplant that has been performed since the program started in 1975 is only 2,700. So that included both living and cadaveric. But it's only 2,700 since 1975.
Wow.
Yeah.
Okay. So how long do patients typically have to wait? You mentioned kidney transplants the most common. How long would a kidney patient have to wait typically to
Well,
get a transplant?
in average, actually, for kidney patient, they may actually wait about 10 years, it's very long waiting, because our donation, our transplant rate is very low. So it's like even organ donor, we can say about organ donor, in a year, we have about 30 to 40 organ donor only. So that's not huge. I mean, it's less than one donor per million population. So we can expect the waiting list of kidney is average about 10 years. And that's for kidney because they can wait long because they have dialysis. But what about other organ? They cannot wait long. They will die because there is no transplant.
Can I ask you, just to stay on the topic of kidney patients, if I understand correctly, Malaysia has among the highest number of patients requiring dialysis. This is per capita in the world, and half of them are eligible for kidney transplant. You mentioned there's living organ donation and also a deceased organ donation. Is it more common to see living organ donation where you donate part of your liver, or part of your kidney, or one of your kidneys? Is that more common than deceased organ donation?
The situation in Malaysia, actually, our living transplant is more than cadaveric transplant. Yeah, so this is something that happening, and although it's more than the cadaveric, but it's still not enough for the demand lah. And then what if we compare our practice with other developed country and with the country with the highest transplant, they focus more to cadaveric. They have highest cadaveric than the living. That's how it's supposed to be. Yeah.
Okay. All right. That's interesting. To talk to me about the two types of death, the brain death and cardiac death, and how the type of death affects the viability of organs and tissues for transplant.
All right. As what we practice in our country now, we only procure or retrieve organ from brain dead patient, since the brain dead patient usually are ventilated and they are still maintained with the oxygen, so the organ can still functioning well. So we are taking the organs from the brain dead patient. Whereas if patient died of cardiac death, in internationally or other practice, we can still take organ from the cardiac death, but we don't practice in our country. We only take tissue from the cardiac death patient. Yeah.
Why don't we practice it in our country?
Because it has a different technique, which we haven't come up with the. We are looking to explore this option actually for the what we call as a DCD, donation of the cardiac death. So this is something that we explore, and then we need to train our staff, and then we need to develop the SOP and so on.
Right. So statistics from the National Transplant Resource Centre showed that in the past 25 years, only 1% of those who are pledged to become organ donors after their death have actually kept their promise. Dr. Hasdi, can you help us understand why this number is so low?
Okay, this is a very common question that I've been asked by media, but I think this is something that we misunderstood. First, because not necessarily if you are pledger that you will automatically become a donor because of our opting-in practice, that we still need the permission from the family. And then the other thing is we have to understand when people die in the hospital, sometimes they need a mechanism that we can actually detect this is a pledger or this is a donor register. So we somehow have a weakness in that sense, you know. So the detection of this donor register in the hospital are still lacking. Although we have an effort towards that, we have a team in the hospital. In every hospital, actually, we develop a team to detect this donor register who died in the hospital. So, but we're still missing them. Okay.
Okay.
And then that's the other angle that you look at, and then the other angle when you detect, and then you know that it's a pledger, or even actually we approach every potential donor. And then subsequently, we ask the family members. That is another challenge where the family member, either they didn't know about it, they didn't know the wishes of the deceased. So according to our recent data, it shows most of family members didn't know the wishes of the deceased. So this is something, obstacles for us to take the consent from the family. Yeah.
Okay, well, let's talk about these two obstacles. The first being detection when a death happens in hospital that the person has pledged to be an organ donor. Where does the National Transplant Resource Centre fit into that system of detection, and how might the MySejahtera app, now being an avenue to register as an organ donor, how might that help narrow that gap and aid in the detection?
Speaking of detection of the donor, we have two ways of doing it. First, we have administrative ways, which is the MySejahtera. So this is all administrative ways. And then the other is clinical ways. So this is a doctor's job in the hospital. Okay, so like you said about MySejahtera, actually is one of the good ideas to what I can say to improve the detection. So the first stage of MySejahtera, we register as a pledger. But later on, we're going to develop further, which we actually will link to the system in the hospital. So they're going to have information about donor register in the hospital. But that one, I'm not sure when it would complete later on. Okay, but we are towards that. So if we can do that, and then later on, but it's still the role of the doctors or the team in the hospital to be active looking for donor. Yeah, because this is what has been done in other countries. So a part of he is a donor or not, but you have to start talking. You have to initiate the detection. But if we didn't do that, we still will have some missing of the donor. Yeah.
Dr. Hasdi, would that also include private hospitals as well? The role for doctors to help detect organ donation for when deaths happen in private hospitals? Is that what you're referring to as well?
Actually, as of now, the team, what we call as a Unit Perolehan Organ Hospital, this is what we call it in KKM Hospital, or you can name it as UPO. So this is a very dedicated team, very trained team, including doctors and nurses. It's all in the KKM Hospital. And then in the private hospital, they don't have UPO or unit providing organ hospital, but they have a small team, what we call is a tissue organ procurement team. But they are not consist of doctors. Usually, it's a nurses. Normally, private hospital, they will refer to National Transplant Resource Center directly if they have potential cases. Yeah.
Okay. Well, you mentioned the second challenge was in getting family and next of kin to honor the donor's pledge after death. Where do you see this biggest hurdle, and how best can we try to overcome it?
All right. I have worked in my department for 11 years. I can see some improvement or changes in that sense, but still there is obstacles. So what we do now, we encourage of our donor pledger to inform family members. And now with MySejahtera, you automatically will be notified to your next of kin when you register. Because you have to fill in the next of kin and then phone numbers and so on. It is good in the sense that they know what you want, and then this is something like a will or yeah, you know. So that's that's a good ways of doing it. And another way, but I can comment a bit. If you want to know, less than 20% from actual cadaveric donor, we have about 779 cadaveric donor. Less than 20% is actually a pledger. The rest is not a pledger. It's not a donor register. Yeah, so donor
Right.
register is just awareness or a system that we want to create so that people wanted to do it and so on. But we can approach everyone. If you're
Okay.
not registered as well, if the family consent for you, then it can be proceed as well.
Okay, well, let's address very quickly some of the misconceptions. I can imagine that some family members might be hesitant in allowing organs to be harvested after death because they're worried that the religion won't permit it. They're worried that the body might be desecrated or disfigured after death, and they're worried that it might delay burial rituals or last rites. How would you address this, Dr. Hasdi?
Oh, we have addressed these all issues for so long already. But then we see the changes also, and I can see a very good improvement in that concern, particularly religion. And then we have Islam as the majority religion in the country. So another issue, dilemma in Malaysia, the majority people are not donating.
Okay.
So yeah,
What
but
what is may I just interrupt? A couple minutes we have left. I just want to ask you, what is your message to potential donors and their family members who may be watching tonight?
all right, I have a message that please support organ donation. If your loved one or your family is registered, please fulfill their wish. And then if you haven't told your family, and please also inform your family members. This is very important, and we have to start advocate this cause among ourselves. Yeah, that's good.
Definitely. Well, hopefully more people will sign up after watching this show. Dr. Hasdi, thank you for joining me on the show tonight. Dr. Hasdi Harun from the National Transplant Resource Center. A quick break here on Consider This. We will be back with more. Stay tuned. Hi, welcome back to Consider This. I'm Melissa Idris. We're hoping today's episode will encourage more people to sign up as organ donors and for next of kin to honor donors' pledges. But beyond organ and tissue donation, there is also another consideration: pledging one's body for the advancement of the medical sciences. In 2012, University Malaya collaborated with Tzu University and started the first Silent Mentor program outside Taiwan. Silent Mentor is a national body donation program for medical education, training and research. Professor Dr. Saw Ek joins me now. He is the Program Director for University Malaya's Silent Mentor Program. He is also a Professor of Orthopedic Surgery at the university. Dr. Saw, thank you for joining me today. Can you begin our conversation today by telling me a little bit more about the Silent Mentor Program and what it hopes to achieve?
Okay, thank you, Melissa. Silent Mentor program, it actually hopes to get the public to incorporate, to help out in the medical training. Yeah. As we know, medical training, the doctors have to learn a lot of knowledge, learn about skill, But another aspect is to learn about humanistic character, how to treat patient with care and sympathy. So this is the objective. So that we hope through this voluntary body donation program, we can not only provide material, surgical skill training, but also we can help the doctors to know that there are people out there, patients or even individuals who are willing to donate, yeah, their belongings, I mean the whole body, for them to train on. So this is for the doctors to be the recipient side. You are getting your training from your patients. You know, they are the one volunteer giving it to you. So we hope that we can have a more holistic type of medical training, knowledge, skill, as well as getting a compassionate and caring doctors through the program.
Okay, can you help me understand why that's important? Because if I understand correctly, many medical institutions are adopting alternative models, especially in the teaching of anatomy education. I think many are using virtual dissection methods, you know, in this kind of blended learning era that we have right now. Help us understand the value of cadaveric dissection in medical education, especially in terms of those humanistic values you mentioned a bit earlier.
All right. Now, as far as information, as we say, anatomy training, using of a 3D computer or plastic or simulation object is different from what you can feel or what you can see in the actual human body. This has been the natural form of medical training since thousands of years ago. But because I think the sources of body donors are less, so it has converted, many institutions have converted into these alternative models. But the quality, yeah, the perception for students is not as good as the real body itself. On the other aspect is surgical training. Surgical simulation using, again, computer or digital methods is not the same as using the real life, yeah, tissue. So this is by using a freezing method. Yeah. So after we defreeze, actually the tissue and the body organs and so on are as close, very close to the real structure. This will provide the best available training, especially for new doctors to train standard procedures, but then also sometimes for senior surgeons to learn or to trying out advanced procedure to be done in our country.
Right.
Then the third aspect, the humanistic one, is the one that I think is the one touching on us, because this sources comes from your patients. They themselves volunteer. They are not our patients. They are not, probably not even treated in our University Malaya Medical Center. They are from Alosta, from Johor Bahru, and so on. And once they pass away, they volunteer to get their body all the way to here and to let the surgeons and the doctors train on them. So all the doctors have to know the background. They have to know the donors. So our one of the concept is that they need to treat or handle the patients, we so-called patients, as if they are alive. So with respect and dignity. So
Wow.
through this, so we hope that the doctors or the surgeons or the medical students can can start to learn to appreciate the contribution by these donors. Yeah? And I myself, we can feel it, although we are not the one cutting, but we know the background of these people, and then we can feel, you know, their love that being spread around when they make this decision. And we hope our doctors also can feel the same thing, and we
If
hope it can translate to the feeling when they treat their patients in future.
Well, I think that's remarkable that you actually get to know the donor. Is that not that's not common practice, as I understand it. That most medical schools, the students don't know the name of the cadaver, let alone the background, the family. Is that accurate to say?
Yeah, Melissa, you are really correct. Then, in most Western institution, or even from here, so like Thailand, they have many body donors as well. But the concept of a voluntary donation, the students or surgeons generally do not know who is this person. They would respect the donors as a whole, but then the silent mentor concept is you have to treat them as a patient. You have to know them, you know their relative, their children, and what disease they are having, and you address them as a person. So that is the main difference, and why we call it silent mentor, because you must know your teacher, right? So this is the teacher do not talk to you, but you must know them so that you can respect and treat them with dignity.
I love the name Silent Mentor because it feels like you're still teaching even after death. So what a wonderful way of honoring, the medical profession. Can I ask you, Doctor, what would you say is the level of public awareness and acceptance about, Silent Mentor program, about voluntary body donation? Are there, how many number of pledges would you say you currently have for body donation?
Okay. I think the awareness is much less compared to organ donations. Yeah, organ donations has been around for a long time. And Silent Mentor program, we started here 2012. So this is exactly 10 year, a decade. But still, because the nature of this condition, we cannot too openly promote or advertise this because it's related to funeral and to situation which is to some people may consider it negative. So at the moment it is still the awareness is still lacking. So we hope that with this 10th anniversary, we have done a series of exhibition and so on, let that more people will know, not really for donate, but to know, aware of this concept, so that they can support these wonderful individuals who have pledged and eventually who have donated to us.
Well,
By now,
that
we have 100 over people donated already until for the past 10 years, 136, I think, to be precise.
Right. Well, that's precisely why we're doing the show tonight with the news of, that you can now register as an organ donor on the MySejahtera app. The hope is to encourage more people to do that in hopes of saving more lives. But you can also, in death, help educate doctors and advance the medical sciences. Can I ask you who is eligible to pledge as a voluntary body donor? Are there restrictions as to who can and cannot pledge?
Okay. At this moment, as long as a person they have this burial permit, that means there is no medical legal issues or anything that need further investigation. So the burial permit, so that is one requirement. The other thing is you need a body has to arrive at our Silent Mentor Center in UMMC within 8 hours of death. So that limits the physical the places. We accepted mentors from as far as Kedah and also Johor Bahru. Unfortunately for Kelantan and Terengganu, the distance is a bit too far, so we cannot arrange for them to arrive in 6 hours. So as long as you are not overseas, not Kelantan, Terengganu, or East Malaysia, so other part of the country, you have a burial permit, and also the timing. Timing is within 8 hours. Oh yeah, another aspect is those with infectious diseases. Like viral diseases, hepatitis, and also COVID, and so on. So that is also being excluded. Otherwise, those with natural causes of death, including cancer, advanced renal, heart failure, and so on, they are potentially actually eligible to be a donor.
All right. Dr. So, can I ask you in the couple minutes that we have left, what would be your message to those who, all the potential silent mentors out there and also their family members? What would be your message to them?
Okay, I hope that everybody will know, these people, so that we can all together support those who are willing to donate, and then they are actually helping us to train future doctors who are more skillful, who are more knowledgeable, and who are more compassionate. Overall, we can improve the quality of our medical education in this country.
Dr. So, thank you. I appreciate your time. Professor Dr. Soik from University of Malaya, wrapping up this episode of Consider This. I'm Melissa Idris, signing off for the evening. Thank you so much for watching, and good night.